Good morning, I'm Rose Lee, and today we'll explore new advances in type 1 diabetes, an affordable health care plan for you and your family, how to protect yourself from catching the flu, and the health benefits of taking a vacation, all when we return. Influenza or flu is a respiratory infection that's passed through the air to enter your nose or your mouth. It's easily spread from youth to adults. However, leaving adults 50 years or older with chronic medical conditions at an increased risk of flu-related complications. And it becomes worse and causes serious illness and hospitalization and even death. Joining us this morning is Dr. Mylin Han, an American Lung Association volunteer, medical spokesperson, and expert in influenza, pneumonia, and respiratory health. And JoJo O'Neill, a radio personality living with asthma, who became ill with the flu and passed it to her sister and niece and felt terrible about it. Good morning, ladies.
Good morning, Rosalie.
So, Dr. Han, why is it so important for people over 50 years of age to get a flu shot? And also share the importance of the new My Shot campaign.
Well, thank you, Rosalie. So the flu can affect anyone and can be devastating in anyone, but particularly for people over 50 or for those who have chronic medical conditions like asthma, like JoJo, or COPD, diabetes, heart disease. For those patients, what can, in some people, just be, say, 2 weeks at home. For patients with a chronic medical condition, the flu can actually turn into hospitalizations or even death. It can be incredibly serious. So for patients that are over 50 or have a chronic medical condition, we're here today to get out the word about the importance of getting the flu shot. Or if you have a loved one that's over 50 or has a chronic medical condition, I see patients at the University of Michigan in Ann Arbor, and there unfortunately are a lot of myths about getting the flu shot that we're here today to try to bust some of those. But a lot of times I do struggle with trying to convince my patients to get their shot. So one of the things that I do try to talk to my patients about is, even if they won't get the shot for themselves, the importance of getting it to protect your loved ones.
Well, I was born and raised in Michigan, and I remember the flu. And I remember the cold, damp weather and being snowed in. It was fun when you were a kid, but in most cases, we were snowed in and sick with a lot of siblings. All right, so doctor, share how flu affects our lungs' respiratory system and how critical it is to our health in a number of ways.
Yes, absolutely. So influenza is spread via respiratory droplets. So that can, for some people, it might be coughing or touching something that's infected. Unfortunately, it's incredibly easily spread. Once the virus sets up in the body, it can cause things like body aches and fevers. But for some patients, it can actually go into the lungs and cause pneumonia. One of the things that can be incredibly scary, though, is that influenza in particular can then set the body up for what we call a secondary bacterial infection. And so it starts off with the virus, and then you get something else on top of it. And that's when we see patients that end up hospitalized or even in the ICU on breathing machines. So it can be incredibly scary. And unfortunately, this year we've already seen cases of influenza, and we've already seen influenza-related deaths already. So that's why October, this is the month that the CDC recommends that people get their flu shot. So we're here to get out the word. If patients aren't sure where to go, we have a website, getmyshot.org, where they can get information not just about the flu vaccine, but also where to get it in their area. They can type in their own zip codes and get more information.
JoJo, you suffer from asthma. Share with us about your experience with this condition when you caught the influenza virus. And tell us, did the virus affect you more severely because you have asthma?
I'm not sure if it affected me more severely because of the asthma, but just having asthma and being over 50, it really just took me down. I'm very active on a regular basis. I work at a couple of jobs. I run a nonprofit organization, and so all those activities were shut down. My full-time career is a radio personality, so I had to think about my coworkers in the studio using the same microphone. I had to think about my sister who has a chronic health condition, and I actually did pass along the influenza virus to her as well. And so it was just really difficult. I wish I'd had some protection from the symptoms, going from being very active to being not able to move much, body aches, fever, nausea, just a really awful time, low energy. It was real. And then in the back of my mind thinking, this could possibly affect my breathing. How am I breathing? Am I breathing okay? Is this going to trigger asthma symptoms? Am I going to have to be hospitalized? It was a very traumatic time, and so I wish I'd had that flu shot. So that's why I'm here, to try and help others realize that, yeah, I'd rather have that protection and possibly lessen the symptoms than to have to go through what I went through again. It devastated me and just took me way off my game. It shut me down.
So, doctor, a person with asthma like JoJo, can they be more severely affected because of the asthma? And how about other respiratory illnesses?
Well, unfortunately, you mentioned you're from Michigan. In the winter, we do see people in more cramped spaces. They're not getting outside. The viruses get spread more easily. And so really for any patient that has, say, a chronic lung condition, we see a lot of hospitalizations due to multiple viruses, including not just including influenza. So there's rhinovirus, enterovirus, parainfluenza, et cetera. But unfortunately, we don't actually have vaccinations for a lot of the respiratory viruses, but we do have vaccine for influenza, and that's fortunate because influenza is, I think, of the viruses that we see, I think, one of the most potentially devastating. So I think we are fortunate that we do have something that can offer some protection.
Are people who smoke cigarettes at greater risk?
Well, often patients who smoke cigarettes actually do have some mild lung damage, even if they're not aware of it. We're becoming increasingly cognizant that patients who smoke actually often do, if you look at them on a CAT scan, for instance, do have some mild lung damage. And these patients are going to be increased risk for cough and wheezing. And then when you add something like a virus on top of that, then the respiratory system can be even further impaired. So these are the kinds of patients that we do worry about. Obviously, it depends on the individual person, and they should talk to their doctor. But I would say as a group, they're definitely at increased risk.
JoJo, as an on-air personality, do you educate your listeners on how to prevent the flu?
Absolutely, as much as possible, because we have the flu vaccine that's available. I would rather encourage people to get that and perhaps lessen the symptoms, if not just prevent it altogether, than to have to go through some of the symptoms that I went through. And I realize that I have that platform as a radio personality, and so I plan to use it to help others.
Well, I am so thankful that you ladies joined us this morning to educate our viewers to the My Shot campaign and the importance of staying healthy to avoid the flu virus.
Thank you, Rosalie.
Thank you, Rosalie.
Many healthcare professionals believe the Affordable Care Act continues to drive the cost of healthcare up instead of down. But one new model being promoted by some groups of physicians to help patients save money while accessing quality healthcare at a more affordable cost is called direct primary care. This model offers primary care services at a fixed monthly fee in the form of a contract between a patient and a physician provider. The direct primary care model is now offered in 24 states in the U.S. Here to explain the benefits of direct primary care is healthcare professional Joseph DeCapua. Good morning, Joseph.
Good morning, Rosalie. How are you doing?
Joseph, what is the distinction between health care insurance and direct primary care?
Direct primary care is not a form of insurance. There's a distinct difference between the two. One is health insurance, which is through a company, for example, Aetna, Humana, Coventry. That's health insurance where the plan offers all the services, medical services that you would need to be covered. Hospitalization, specialists, diagnostics, lab, rehab, pharmacy. So all those are covered underneath health insurance. Direct primary care is based on a membership format whereupon a patient and a doctor, primary care doctor, sits down and they contract services. A hospital is not covered under direct primary care. The doctor offers a list of primary care services that the patient would receive for a fixed amount, monthly amount, which is usually between, depending on the age, $45 to $125 per month.
So if a person cannot afford health care insurance, will direct primary care provide services most health insurance policies offer?
Direct primary care only offers primary care services, and people have to remember that 70 to 80% of their medical needs can be met by a primary care physician. A hospital is not covered under direct primary care.
Explain how the patient-doctor direct primary care relationship works.
The patient comes in, they speak to the physician, they sit down, and the physician then takes out the contract and they go over the services that are offered underneath this membership agreement. And when the patient decides that, yes, they want to become a member, they then sign up. Usually there's a processing fee. It depends, anywhere from $25 to $75, a one-time processing fee. And then there is the membership fee that's a monthly fee. And again, that is age-related in age ranges. Most doctors do not see Medicare because they do not want to, what we call, opt out of the Medicare program. The program for direct primary care usually stops at people at age 64. One of the benefits of direct primary care for seniors is that usually when the spouse hits 65 and becomes Medicare eligible, that person's spouse does not have insurance and loses insurance. Using direct primary care, they're able to get some type of health care.
So if a single mother with 3 children cannot afford health insurance for her family, is there a direct primary care family plan available?
Yes, there is, and it depends on the direct primary care practice that you go to. Some practices have pediatricians or family physicians that would see newborns and up, but most of the practices for primary care have family practitioners that will see from 16 and up, or internal medicine doctors that will see from 18 and up. So the answer to that is it depends on the direct primary care practice itself.
Thank you, Joseph, for joining us this morning to share this new healthcare services model for those who may not have health insurance coverage but need access to a primary care doctor.
Thank you, Rosalie. I appreciate it.
Diabetes is a serious medical condition that affects over 29 million people in the U.S. And type 1 diabetes can develop at any age, youth to adults. But it must be managed carefully or it can increase a person's risk for other serious medical conditions. A recent national survey shows, despite progress, adults living with type 1 diabetes, or T1D, still struggle with the impact the disease has on their lives. The good news is over 70% of endocrinologists and adults with T1D say recent advances offer hope for a cure. Joining us to discuss new advances in type 1 diabetes is Dr. George Grunberger of the Grunberger Diabetes Institute, and he's also the past president of the American Association of Clinical Endocrinologists. Good morning, doctor.
Good morning. Thanks for having me.
My pleasure. I'm familiar with type 2 diabetes and have done plenty of reporting on it. But doctor, tell us, when evaluating a patient, how do you determine if a patient has type 1 or type 2 diabetes?
Well, thanks for asking, because you pointed out of the 29 million people in the US living with diabetes, a vast majority of type 2 diabetes, about 90%. But the reality is that people with type 1 diabetes are constituting about 1.5 million of these patients. And the incidence of type 1 diabetes is also on the rise, not just in the US, but everywhere else. But your question was, how does one distinguish that? Because all diabetes has in common the fact that those people have high levels of blood sugar, which lead to those dreaded complications. What's different about T1D or type 1 diabetes, that it's an autoimmune disease which results in complete destruction of the cells which make insulin. There are cells in the pancreas which make insulin. So not having any insulin available means these patients are dependent on insulin for the rest of their lives. People with type 2 diabetes might not make enough insulin, but they still make some. Insulin they make is not working properly. So the major distinction is the complete dependence on insulin for people with T1D. To make the distinction, if I see a new patient, basically one needs to have a blood test done, and those tests can actually distinguish two diseases, because those patients with T1D make antibodies which can be measured in the blood.
So is a person born with type 1 diabetes?
No, so everybody's born obviously with the genes which their mother and father gave them, and both types of diabetes have, people inherit those genes. It's not really clear what triggers that condition in people with T1D. So you're born with, not with the disease, but the genes which give you that condition eventually. And then once that genetic predisposition leads to that attack which destroys the cells, one gets the disease. And even though it used to be called, as you say, childhood or juvenile type, people realize you can be afflicted with that at any age. So yes, there's increased incidence in adolescents and the teens, but you can be of any age and still come down with type 1 diabetes.
Tell us about the T1D Unmet Needs Survey, and what differences did the survey find about patients with type 1 diabetes?
Well, I think that survey, which was done on behalf of the American Association of Clinical Endocrinologists and conducted by Harris Poll, focused on, I guess, both things. Number one, to look at the attitudes and the knowledge of physicians, endocrinologists who deal with the patients, but also the patients themselves. How do they feel about, what's going on, and are there any unmet needs? And the key takeaways were on both ends. So majority, as you mentioned at the beginning, majority of those surveyed were excited about the advances being made, and most actually hope there's going to be a cure. But at the same time, 9 out of 10 patients surveyed actually related the struggles they have with actually living and doing the things which ordinary people can do without thinking about that. More than half of the patients avoid certain social situations, avoid going eat out, vacations, exercise, driving, and what have you. So clearly unmet needs. So the current advances are not addressing everything. And so there is hope for better ways to manage the disease with new, even more advances, and the struggle people have in trying to keep the blood sugars within the recommended ranges. That adds to another stress, because as you know, everything you do is going to eventually result in some changes in blood sugar levels.
Were there any surprises found from this survey?
Well, the surprising survey was actually how excited both the physicians and patients were that the advances will lead to a cure. So that was, I guess, heartwarming in a way. But the other one, maybe not such a surprise, is, again, the illumination of those unmet needs that in spite of the excitement, most surveyed felt more needs to be done, both as far as more discoveries, but also just the things which can make their lives a bit easier, and really to emphasize the stress managing the disease today still brings. And I think it really highlights the need for physicians to share their knowledge about those advances with the patients, but also for patients to let their physicians know specifically what is it in their daily lives that need help with.
All right, so where can our viewers find more information on diabetes management?
The viewers can go to GoBeyondInsulinAlone.T1D.com.
Thank you, Dr. Grunberger, for sharing the new advances to successfully treat type 1 diabetes.
Oh, thanks so much for having me.
Did you know taking a vacation lowers stress, reduces the risk of heart disease, gives a better outlook on life, and it also offers more motivation to achieve your personal goals? So if you're overworked, stressed out, or mentally drained, think of the benefits of relaxing and a pampering vacation. According to a 2018 Cruise Lines International Association report, an estimated 28 million people are expected to take a cruise vacation this year, a new industry record. Joining us to discuss the growth of the cruise vacations and all its new accommodations is Andy Stewart, President and CEO of Norwegian Cruise Lines. Good morning, Andy.
Morning, Rose. How are you?
I'm feeling great, thank you. Andy, you're celebrating 30 years of building the Norwegian brand while strengthening relationships with travel partners. Share with us how you've seen the cruise industry change in the last 3 decades.
You know, it's changed so much since I joined the industry back in 1988. The ships were much smaller in those days and had relatively few choices. I think we delivered a great product, but it was basically one restaurant and one show lounge. Those were your choices. Today, we're building ships that are carrying 4,000 passengers. They have 20+ dining choices, including French restaurants, steakhouses, Italians, teppanyaki restaurants, sushi, and I could go on and on and on with the dining choices. Multiple entertainment venues. Offering full Broadway productions and all sorts of other entertainment. And then the top of the ship is just incredible. The things that we're putting on the top of the ship these days, including, would you believe it, a racetrack. We have a racetrack where cars are whizzing around the ship at 30 miles an hour on the top of our 2 new ships, Norwegian Joy and Norwegian Bliss. So I can't tell you how much the industry's changed, Rose.
With 28 million people embarking on a cruise this year, why the increase of popularity of people hitting the high seas?
You know, I think there's a number of reasons. One is value. It's a tremendous value vacation. And there's a choice for every budget. And so I start with value. And then I think about the destinations we're sailing to. You know, we're sailing all over the world. We have these 2 new ships, Bliss and Joy in Alaska. We have Bliss coming down to Miami to sail out of Miami, your hometown. We're sailing all over Europe with ships out of Copenhagen and Barcelona, Rome, and Venice. And then further afield, we're sailing between Sydney and Auckland, Australia, New Zealand, Singapore and Hong Kong in Asia. So really destinations all over the world. And lastly, I would talk about the ships. The amenities that are on these new ships are just mind-blowing. And so really bringing in new to cruise, people who haven't cruised before and are hearing about these ships and saying, really, it's a cruise ship?
So that explains the increase in cruises, because consumers' lifestyles continue to change as vacation choices change. So do you believe consumers are ditching traditional land-based vacations for all these great amenities?
Yeah, I absolutely believe that. I believe we offer incredible value, and then the guest satisfaction scores for cruising are the highest of any vacation option that I've ever seen. So there's no doubt in my mind that people are trying cruising for the first time, and once they try it for the first time, they'll cruise forever, because it's just such a fantastic experience, and then they can go from destination to destination. So absolutely, we're bringing in new to cruise, and we're bringing people back again and again and again.
And no driving around. Yeah, love it.
Well, you know, I talk about that because when you think about the evening and the idea, I've got to get a cab, I've got to get an Uber, I've got to figure out the restaurant, where is it, how do I get there, how do I get back? On a ship, you don't think about any of that. You pack and unpack once. You pick a different restaurant every night, but you don't have to worry about how to get there or how to get home. You pick a genre of entertainment, and again, you don't have to worry about, am I going to, how do I get there? Will I be on time? It's all right there, and full Broadway productions, late night comedy, anything and everything you can think of. So it's really, it really is a hassle-free vacation of the highest quality to destinations all over the world.
So tell us, Andy, how is the cruise industry responding to the increased demand for cruise vacations?
You know, we're building ships as fast as we can, Rose. And, Norwegian Bliss and Norwegian Joy are two examples. Next year, we have Norwegian Encore coming at the end of October next year, and she'll come into Miami, and we'll christen her there. So I hope you'll join us for that when we're in Miami. Yeah.
Great. That's my birthday month. I'll be there.
Oh, there you go. We'll celebrate on board. So we're definitely building more ships, and each one gets a little bit more exciting.
What other new exciting features and accommodations to help us relax are on these new cruise ships?
You know, I get excited about the range of accommodations we have on board our new ships. We have an area on our newest ship called the Haven, which is a private key card access area, and we have a butler, a concierge, priority embarkation, disembarkation, a private restaurant, private bar, a beautiful observation lounge that's private to guests in the Haven. So that's really something that we've expanded and has been incredibly popular for our more affluent guests. And then we have accommodations that meet every other budget as well. Because staterooms for solo travelers that have been very, very popular. Family staterooms for folks with children, connecting rooms for folks who would like to take a couple of rooms with children. And then for the more budget-conscious traveler, we have inside staterooms. So the range of accommodations for every kind of shape and size of family and budget is broader and more expansive than anything we've had before.
All right, so you're meeting all consumer needs.
Absolutely. A lot of flexibility and a lot of choices.
All right, so where can we find more vacation choices to whatever floats your boat?
ncl.com is our website, and there we have information on all of the different ships, all of the destinations that we sail to, and all of the amenities on board the ship. So I'd encourage your viewers to go to ncl.com.
Thank you, Andy, for sharing the findings of this new report from the Cruise Lines International Association and the unique new features available on Norwegian Cruise Lines.
Thanks for having me, Rose.
Advances in healthcare are a result of the involvement between a patient and their healthcare provider. Health maintenance is vital to living a greater quality of life. And vaccines are a healthcare option to protect ourselves and those around us so that we can relax and enjoy life. Share with us your approach to keep yourself and your family healthy at facebook.com/Rose Lee Show, and follow us on Instagram at The Rose Lee Show, and watch this episode and many others 24/7 at RoseleeArcherShow.com. Thanks for joining us, and we look forward to seeing you soon.